Welcome to this presentation on understanding anorexia nervosa. My name is Omaz, and today we'll be discussing what anorexia is, its symptoms, causes, some of the risk factors and effects in health, how to recognize it, treatment options, and how to support someone with anorexia. So what is anorexia? So anorexia is a serious eating disorder characterized by an intense fear of gaining weight and a distorted body image. Individuals with anorexia often see themselves as overweight, even if they are significantly underweight. This disorder goes beyond simply wanting to be thin. It's a complex mental health condition that requires treatment and support. So, symptoms of anorexia can be both physical and psychological. So, physically, individuals may experience extreme weight loss, fatigue, dizziness, and hair loss. Psychologically, they may be preoccupied with food, dieting and body size, refuse to eat, engage in excessive exercise, deny hunger, and withdraw from social activities. Recognize these symptoms early on is really important for getting the necessary help. So, causes of anorexia can be varied and include biological, psychological, and environmental factors. So, biologically, genetic factors and irregular hormone functions can play a role. Psychologically, low self-esteem, perfectionism, and obsessive-compulsive traits are quite common with those who've been diagnosed with anorexia. And environmentally, cultural pressure to be thin, peer pressure, and stressful life events can trigger or worsen the disorder. So there are certain risk factors that can increase the risk of developing anorexia. So females, especially during biological and social transition periods, such as the onset of puberty, change in relationship status, pregnancy and postpartum, menopause, and sort of changes in social roles, children and adolescents. So although eating disorders can develop at any age, risk is sort of highest between 13 and 17 years. And then competitive occupations such as sports, performing arts, and then activities that emphasize thin body shape or have certain weight requirements such as modeling, gymnastics, dancing, athletics, wrestling. And then another risk factor would be sort of history of dieting or even history of dieting within the family. And then of course major life changes or significant trauma can be quite a high risk factor. So anorexia has severe effects on both physical and mental health. So physically it can lead to heart problems, bone loss, anemia, gastrointestinal issues, and a lot of mineral imbalances. And mentally, individuals can suffer from depression, anxiety, and other mood disorders. And socially, they might become isolated from friends and family, and these effects underline the importance of how significant it is to get sort of timely treatment. So recognizing anorexia can be very challenging, but there are some signs, including noticeable weight loss or being significantly underweight, avoidance of meals or situations and social settings that can involve food, frequent complaints about weight or body image, wearing loose clothing to hide weight loss, and often commenting about feeling fat. So if you notice these signs in someone, it's important to approach the situation with a lot of sensitivity and support. So treatment for anorexia typically involves a very holistic and all-rounded approach. So a combination of medical, nutritional, and therapeutic interventions. So medically, severe cases may require hospitalization. Nutritionally, dietitians often help to establish healthy eating patterns. And therapeutically, therapy, individual and family therapy, and sometimes group therapy as well, is commonly used. In some cases, medication might be prescribed to treat underlying mental health conditions. So if you have a friend who may be struggling with anorexia, there are several ways you can support them. So encouraging them to seek professional help, offering emotional support without judgment, and of course avoiding commenting on their appearance or eating habits. Educating yourself about the disorder to better understand what they're going through, being patient and understanding as they navigate the recovery are all really important things. There are lots of resources available to find help and more information regarding eating disorders. The National Eating Disorders Association is a really great place to start. Websites like the NEDA and Eating Disorder Hub provide really valuable information. There's BEAT, which is the UK's eating disorder charity as well, which is also available. And locally, there's school counsellors, support groups, and of course the NHS, which can offer help and support. Thank you for listening. I hope this has been helpful.